ahead.
Okay. My question is for Dr. Tedros. On December 31st, 2019, the Taiwan Center for Disease Control sent an email to the World Health Organization informing WHO of its understanding of the disease and requesting for more information. In that email, they used the word atypical pneumonia, which they claim is a word commonly used to refer to SARS, a disease transmitted between humans. Why did WHO not take Taiwan CDC observations seriously? Is my question.
Thank you, Savio. I think Mr. Solomon will take this one.
I may follow.
Thank you, Tariq, and thanks very much for the question. It's appreciated because it gives us an opportunity to set the record straight, which I'd like to do right away. And then I'd also like to address questions of their participation at WHO meetings, because these questions continue to come up as well. So did Taiwan warn WHO on 31 December 2019? The answer is no, they didn't. They did send an email, but that email was not a warning. It was a request for more information on cases of atypical pneumonia reported by news sources. They sent that request through the IHR system that Taiwan, China, and all IHR focal points are part of. The email asked for more information about news reports that WHO and most public health services already knew about. Others, in fact, sent similar emails that same day, also asking for more information. These reports about atypical pneumonia cases came from Wuhan itself on the internet, and they came through a website run by ProMed. That's an acronym for Program for Monitoring Emerging Diseases. The reports were therefore already available, and the Taiwanese email just requested in very kind terms more information. Why then has this story of warning continued to circulate? Well, the answer to that is in part because of the rules for the IHR system itself. That is the electronic communication system supporting the international health regulations and its focal points from around the world. These focal points around the world are the direct channel to WHO for information about disease outbreaks. The communications are confidential in order to promote openness within the IHR system. So until Taiwan CDC indicated that they didn't expect confidentiality about that email, we couldn't offer details. Then on 11th of April, that changed. Taiwan's authorities held up the email at a media briefing. Since Taiwan has made the message public, I'll read out the full content today. It reads, and I'm quoting in full, "News resources today indicate that at least 7 atypical pneumonia cases were reported in Wuhan, China. Their health authorities replied to the media that the cases were believed not SARS. However, the samples are still under examination and cases have been isolated for treatment. I would greatly appreciate it if you have relevant information to share with us. Thank you very much in advance for your attention to this matter. Best regards." The email wasn't a warning, and it only contained information that WHO already had picked up from internet reports. It's also important to say that the Wuhan situation had already been captured by WHO on that day, 31 December 2019. WHO activated its incident management protocols the next day on January 1st, and then, along with embedded scientists from other governments, WHO began the work which continues to this day, analyzing the data and seeking additional information. On the 4th of January, WHO provided information about this situation publicly. On the 5th of January, WHO shared detailed technical information through this IHR system. This included advice to all member states and all IHR focal points to take precautions to reduce the risk of acute respiratory infections providing guidance on the basis that there could be human-to-human transmission. On the 10th and the 11th of January, WHO published a comprehensive package of guidance on how to detect, test for, and manage cases and protect health workers from potential human-to-human transmission based on our previous experience with coronaviruses. And as you know, there was a global press briefing on January 14th where WHO spoke about likely scenarios around human-to-human transmission. I hope that's helpful in understanding the December 31st email. We know there are also questions about Taiwan's participation in WHO expert meetings and questions about their participation in the World Health Assembly. WHO is an intergovernmental organization, meaning that countries decide how the organization is structured and on its policies. Some 49 years ago, the UN and WHO decided that there was only one legitimate representative of China within the UN system, and that is the People's Republic of China. That decision still stands. WHO is also a specialized agency of the United Nations, and as such, aligns with the UN and must do so coherently. The work of WHO staff, in line with our Constitution, is to promote the health of all people everywhere and to assist with, but not decide on, issues at the World Health Assembly. So, regarding expert meetings on technical health matters, last year, Taiwanese experts were included at 8 expert meetings, and there were 6 other informal technical meetings. This year, in response to COVID-19, Taiwanese experts are involved in key groups and networks. We've had telephone conferences with their CDC, Dr. Van Kerkhove and myself, and will do so again. And as noted, their IHR contact point links their CDC directly to WHO headquarters. In the COVID-19 response, especially, they have had notable successes, and we appreciate their contributions. Regarding the World Health Assembly, the next one will be in 2 weeks, starting on May 18th. The involvement, if any, of Taiwanese observers in that assembly is a question for the 194 governments of WHO. This is not something that WHO Secretariat has authority to decide. And indeed, 2 countries have already formally proposed that member states consider this matter at the World Health Assembly. And a final word. A lot of attention has focused on Taiwan's participation with WHO, and we understand that. We are also mindful that there are other places, too, that, for many different reasons, look for connections to WHO. But it is not the role of WHO staff to be involved in geopolitical issues. In fact, our principles of neutrality and impartiality exist to keep us out of those issues and to promote the role of evidence-based science in all our work. Our role, even when we operate in sensitive political areas or in complex humanitarian emergencies, is to follow the rules and policies that member states set out and, working within them, to strengthen health systems and access to health care for all people everywhere. Others may want to add to this. Thanks very much.
Just one small clarification on the issue of atypical pneumonia. Atypical pneumonia is an extremely common form of pneumonia that occurs around the world. There are millions and millions of cases every year. And atypical pneumonia effectively refers to the fact that the cause of the pneumonia is usually atypical or not necessarily diagnosed as some of the normal causes of pneumonia, one of the usual causes for a community-acquired pneumonia. Very often they can test negative on first testing and then they're subsequently retested for specific pathogens. And studies I know, up to 1/3 of community-acquired pneumonias can be considered to be atypical, in that you have other pathogens that are found would be known as atypical pathogens, pathogens that don't typically cause that type of pneumonia. And certainly at a global level, they would most be represented when they're finally diagnosed by Legionella pneumonia chlamydia pneumonia and mycoplasma pneumonia as the causes, which are bacterial causes of atypical pneumonia. So the most common causes of atypical pneumonia are bacterial causes and not necessarily viral or others, but obviously viruses can cause atypical pneumonia. But to say that atypical pneumonia is a homonym for SARS is entirely incorrect.
If I can also supplement, so just to say in the beginning, that email that Steve read out did not mention human-to-human transmission, and I think that is important. But from day one, from all of our experience with other respiratory pathogens and from SARS, from MERS, you operate on the possibility that that may be possible. And from the beginning, with our partners, with our global expert networks, with all of our internal staff at the 3 levels of the organization prepared for this. And so even the first notifications that we had through our event information system, which is what Steve has mentioned, which is the IHR mechanism by which we notify all member states and contact points. We talked about protection against acute respiratory infections, and there was details in there about this. And as more information became available and as more details come from the investigations that are taking place, you modify the guidance. Having said that, our first technical package of guidance that was issued to our emergency directors at all of the regions, to all of the WRs, and made public on our website, put out guidance preventing against human-to-human transmission. And it focused on transmission via respiratory droplets and contact. And in the situation of healthcare settings, focused on the potential for aerosol transmission or airborne transmission when you have, in the context of aerosol-generating procedures. And again, this is based on our experience with other respiratory pathogens, SARS, MERS, influenza. With the first and foremost idea to protect our healthcare workers who are caring for patients. And this was before diagnostic tests were even widely available. And so what we aimed to do was immediately try to put out information to warn all of our member states and contact points about how to find cases through surveillance guidance, how to collect samples safely through our laboratory guidance, how to protect healthcare workers who are caring for patients in our infection prevention and control guidance, how to care for patients in our clinical management guidance, which was focused on severe respiratory disease. Because again, even without information on the details of what disease this might have caused, you anticipate that this would cause a severe disease or could cause a severe disease. And lastly, we also put out a readiness checklist, which was a series of questions which helped everyone look at how ready are we? How ready are we for an emerging respiratory pathogen, which is what this was. And we've said previously, this COVID-19 virus, SARS-CoV-2, turned out to be the latest disease X. And disease X is what we are all anticipating. It's not a matter of if, it's a matter of when. And the DG has said this before. So this was something that could happen because diseases come from, they spill over from animals, and this is happening all the time. But we need to ensure that we put out guidance as quickly as possible to help prevent onward spread, protect people who are caring for those patients.
Thank you very much for this answer on this topic. Next question is from CNBC. That's